Hello, listeners. A warm welcome to Views on Health. A great pleasure once again to have on the program tonight Dr. Isurujith Liyanage, who is a consultant, a gastroenterologist, and hepatologist at the University of Sri Jayewardenepura. A warm welcome, Doctor, back to SLBC and the studios.
Thank you. Pleasure to be here.
And for the information of our listeners, the topic under discussion tonight is reflux. Over to you, Doctor, without any further ado, to introduce the topic, reflux.
Right. So we thought of discussing reflux because it's quite a common thing that our listeners can have. First of all, I want to kind of clarify some misconception that run across our society. That is the term gastritis. So some people call it gastritis, symbolizing gas as in air, which is again a misconception and a wrong way of interpreting it. So I'll first explain what gastritis means, because a lot of people confuse the two and they sometimes refer to both reflux and technical gastritis as the same issue. So gastritis means inflammation or redness or swelling of the interior lining of the stomach. So that's a totally different entity altogether from what we are discussing today. Probably on a later date we can discuss gastritis. So reflux means regurgitation or return of the contents of the stomach into the food pipe, which is also called the esophagus. So what happens is, well, it is of multifactorial in origin, so a lot of reasons for someone to get reflux. But ultimately what happens is either the acid in the stomach, food content, or air from the stomach comes into our food pipe involuntarily, and at times that we don't want it to come, and at a more frequent rate than it should come in a normal person. So if you take a normal person, a bit of reflux is quite normal. So we can have, there's no hard and fast rule, but roughly about 20 episodes of reflux per day is quite normal. And it is normal for you to have some, we all burp. So that is the normal common man's term for gas reflux. So that and a bit of acidity in the tummy, especially when we eat a fatty meal, a heavy meal, or lie down early after a meal, is a common occurrence. But when it occurs at a higher rate, it is pathological, and then we call it a disorder, an issue. The other time where it becomes problematic is that when that leads to pain. So they can have pain in their chest, predominantly in the chest, and sometimes that can lead to irritation in the throat. And they would have either heartburn, that's what we call the chest pain, and throat irritation. They would even feel that as a sore throat. That is also a complication of reflux. But sometimes reflux can also lead to ulceration or erosions, or in other terms, if we call it wound or kind of damage to the food pipe. So that is another complication of this. And when reflux occurs at an excessive amount, I think we all know that at throat, our airway and the food passage kind of unites, and there's it's a junction. And if a lot of things come up, and if that regurgitation is more than it should, sometimes these contents can go into airways, and that can lead to a cough, especially at night, and sometimes that is interpreted as wheezing even. So those are the common symptoms of reflux. So I would summarize it. So it's either heartburn or feeling that food and air is coming up more often than needed. Sometimes it's pain and irritation in the throat, and sometimes people might end up getting respiratory symptoms as cough, difficulty in breathing, which might even be interpreted as wheezing. So those are the common features of reflux.
So, Doctor, you said like 20 episodes a day approximately is a common, normal sort of thing. And also, end of the day, from a lay perspective, it's like burping.
Yes, exactly.
But then when does it come to a point where one has to sit and take notice that this is not just constant burping,
Right.
but there is an issue
Yes.
within the system.
Right. So that's really an excellent question. Now, we don't want our listeners or anyone, for that matter, to be counting the number of burps that they have per day. It sounds irrational. But what really, for almost all the symptoms, in especially in the gastrointestinal tract, what we need to keep in mind is any change. There's no exact hard and fast normal, although I said 20. It's very arbitrary, and it depends on so this 20 or any number comes from different tests. So I don't think we should go by that number or any number for that matter. But what we have to look at is a recent change. That's when you should be worried and have or seek help from a healthcare person. That is, if the way you have been living, and if it suddenly changed and you're having excessive reflux, or if it have been there and if it troubles or disturbs your lifestyle and you're troubled by it, that's when you should take notice. Or if you have any of those symptoms that we just discussed.
So end of the day, if you say that it's like a recent development, that means obviously it's more frequent in terms of feeling the discomfort and wanting kind of like to burp.
Exactly.
Then on the other hand, it might be coupled with heartburn or any other discomforts that you
yes
explained a while ago.
Yes.
So it can be a combination.
Exactly.
So that's when one has to sit up and take notice.
Yes, and also sometimes you would have heartburn or pain in the chest without even knowing that you have reflux. So it's not essential that you know that it's reflux, but a lot of people actually present with heartburn only. So they have pain in their chest. Now again, there's something to note in that context. So the food pipe and the heart, the nerve supply and the area is quite in the same region. So it's very difficult for us, or for the patient as well as even the healthcare worker or the doctor, to determine where that is coming from. So the patient would feel a heartburn, and it's very difficult for you to figure out, or rather assume that it's reflux, because it can also be arising from the heart, which is of course an alarming thing, and you need to do a lot of things about it. So there are many examples even of celebrities who thought they have heartburn, reflux or gastritis, and finally it ended up being a heart attack. So any new onset of chest pain or heartburn, even if it is a burning sensation, warrants medical attention, and I think it's prudent to let a doctor decide whether it is heartburn or arising from the heart.
How long does this condition last, like in terms of seconds, minutes, and the frequency? If it is, say, it's more sinister, say it's more related to the heart than reflux per se, then obviously, like you quite rightly said, it's not for us to decide, it's for the doctor to diagnose what the condition is. But how long does it last, doctor? So give an idea.
So it is highly variable. So some people would have quick reflux, a quick heartburn, and it'll go away. For some people, drinking a little bit of water would help, and it'll go away. For some people, it stays on, and sometimes it lingers for hours and days. So it really depends on the person. Each person. But a red flag feature to suspect that it's from the heart is when it's associated with exertion. When you're climbing a flight of stairs, when you're walking around, if you have a heartburn, or you think it's reflux, but it could be from the heart. So that is one of the rare situations where you exert, you get the pain. When you rest, the pain disappears, then it falls into rather angina. But it's very difficult even for a doctor to clinically, as I mentioned earlier, to determine exactly what it is. We often send the patient for some tests, mainly an ECG, and some tests to check the heart before we kind of confirm that it is heartburn.
Doctor, going on from there, so focusing on the topic of reflux, how does one treat it medically, or is it something that can be sort of overcome through particular diet? Maybe sometimes people do say this is again from a lay perspective. Maybe when you eat oily food, you get this, or when you do this, you get that, or when you do that, you get this. So those are sort of things that we think from, our side. But medically, how does it reflect?
Right. So I think before we go into that, I just want to kind of mention a few facts about how to test these patients and how to confirm this. So the ultimate way to confirm or test is by an endoscopy. But we often, we look for features that would tell us that there could be something sinister. Now, if you could take reflux, as I mentioned earlier, it can be due to a lot of reasons. A lot of causes can kind of end up a person feeling that or having reflux. So most of them are benign and there's nothing for us to worry about. And the commonest reason is a condition that we call hiatus hernia. So that is, a lot of people are alarmed by the fact that they have a hernia once we tell them that they have hiatus hernia. First of all, it is a diagnosis that is made in endoscopy. It's very, very common. It's almost seen in about half to 1/4 of all the endoscopies that we do. So it's a common thing, and it's not something that you need to worry about. So there are a lot of people who ended up getting surgeries and all sort of unnecessary tests because they think that they have a hernia, which kind of tells us that there's something radically wrong with us, but it's not. So this hiatus hernia is a very benign condition, and it does not lead to cancer, and it is something that most of the time can be controlled by some lifestyle changes that I'll go on to explain in a little bit. But I want to kind of emphasize to our readers that hiatus hernia does not warrant surgery, and if at all it is, sometimes it's severe enough for us to have kind of further interventions, and one of the last resorts would be a surgery. And before that, there's a kind of a large number of tests that we need to do to confirm reflux and all. So it's kind of a very sophisticated pathway, and I just want to emphasize that it's not something, whereas because hernias elsewhere is a direct reason for you to have a surgery. This is one place where a surgery or surgical intervention is not kind of very urgently indicated, and it is the last resort, and it comes after a whole array of tests and different things that we try out. So leaving that aside, so what happens in hiatus hernia, or irrespective of that, in reflux conditions, is that we have a small valve at the end of our food pipe to prevent what is in the stomach from coming up. So that valve sometimes doesn't work properly. So that is when you have reflux, and one reason is that condition called hiatus hernia. So if you look at the stomach as a bag that contains food, and the valve as the mechanism to close the bag. Now we know that the bag is not being properly closed. So what we need to do is to stop the bag from being overfilled. That is the first thing to do. So you need to eat less, small quantities. So instead of eating 3 main meals, we advise the patient to take 5 smaller meals, and that includes drinking a lot of water with your food. Again, what will happen is the bag being filled excessively, and the opening of the bag becoming bigger. And then food and acid in the stomach stays for about 3 hours after a meal, and if you tend to lie down after within that time, again you'd end up getting reflux. So when you have reflux, it's always advisable to have 3-hour gaps from the time of your meal to the time that you lie down or go to bed. So we usually tell them to eat at about 6 or 7 in the evening instead of eating late at night. And then there are some medicines that can help, that I strongly advise to leave that aspect to the doctors, and if it is not really responding to these kind of minor lifestyle modifications, to seek medical help and get treatment. One more thing that I forgot to mention. Now I mentioned a valve that is not working properly. So fatty food, caffeine, that is coffee as well as chocolate, and alcohol and tobacco smoking. So these things make this valve even looser, so that they exaggerate or worsen reflux. So it's always advisable to avoid all these kind of food items, and especially fatty food keeps food longer in the stomach. So if you should try to avoid fatty food towards the latter part of the day. So those are the minor lifestyle modifications that we advise when you have reflux. And if you don't respond to those, it's always good to get medical help, but it's not something that you really need to be very, very worried about.
A question that I should have asked you a while ago, may I ask you now, Doctor, is that at which stage in one's life does this situation become very prominent? Because everybody burps, babies are burped after they're fed, and then children, you hear them burp because they are kids, and it goes on. But where it becomes an issue, I mean, can children also be, have issues where this excessive, episodes of burping can lead to something? Of course, going on to the, teenagers, young adults, and the adults and the older generation. So at which stage does this happen in one's life that you have to sit up and take notice?
Right. So first of all, it can be noticed at any point in life, and I want to clarify one thing. Now, excessive burping in itself is not really a disorder, but when you have acid reflux and when acidity is too much, then it becomes an issue, especially as I mentioned, if you get heartburn, throat irritation, that kind of complication. I don't think we need to worry if you have just simply excessive burping. It's very uncommon during young ages of life, but it can suddenly become prominent when you suddenly gain weight. Again, because when you gain weight, there's excessive fat being deposited inside the tummy, and that causes undue pressure on the stomach. And when the mouth is not closing properly, when the valve's not already kind of not working properly, when someone's pressing the bag from the sides, the content tends to go up. So when you suddenly gain weight, that we commonly see that when they recently gain weight, they end up getting symptoms. So we see this quite often in people in their 20s, 30s and 40s. And suddenly, if this appears later in life, especially after the age of 40 or 50 years, then it's something that we need to worry a bit about, because rarely this can be due to issues that more sinister causes associated with the upper part of the stomach and lower part of the food pipe, especially if this is associated with difficulty in swallowing or pain when you swallow, and also if there's a progressive change or a newer change, if you're relatively if your age is beyond the numbers that we just mentioned, it's good to get medical help, because sometimes it can be due to some unwanted things like a tumor.
So you did say that to avoiding fatty foods, and then also lifestyle like smoking and your intake of alcohol, some of those sort of habits that lead to a more sort of, I would say, a worrying condition as against the regular burping that we all do. So end of the day, people do what they want to do, however much you tell them. And if they cut down or they totally stop, will it help? Because out of the blue, you suddenly stop. Won't the sort of fatty foods or the unhealthy foods that you've been eating, and then the smoking and the drinking that you've been into, would have already set in, the damage would have set in?
Right. So that unlike the other things that we discussed, like fatty liver, this is something that occurs on a rather at that point basis. So what I mean is that when there is food that stays longer in the stomach, you get reflux, and then when the food doesn't stay long in the stomach, you don't get reflux. So if you have a lot of heartburn, and if you're having a lot of discomfort in that area, and if you have a lot of regurgitation and reflux, and you change these lifestyles, and if usually if these things are contributed, then it will definitely help. And so there's no permanent damage as such in this. The only thing that long-term reflux can give rise to would be changes in the food pipe and burning in the food pipe. That occurs only in a very minor number of patients, and that is the reason why at one point, if you look at if they have any of the danger signs, or if it is not responding, they need to have an endoscopic assessment. So if that is normal, then there's nothing much that you need to worry about. So it's once you change your lifestyle, usually you'd feel better.
Doctor, would you say that if there's nothing sinister, maybe tests are conducted and you get the reports and your diagnosis is sort of clear, and then you think this can be sort of contained with medication or maybe certain lifestyle changes, maybe intake of certain types of food. Again, from a lay perspective, they say you drink milk, the acidity goes down or it is controlled. Could you comment on that, please?
Right. So I think that's the most important question and the most important message that I want to give to our listener. If and once the tests are conducted and the doctor seen and it's reassured that there's nothing sinister going on, you can still have symptoms, because that if the valve is not functioning properly, or if you're having reflux, usually when you have reflux, you tend to have reflux. So it's a matter of learning to live with it and making those lifestyle changes. I don't recommend anyone being on medicines for a long time. So it's always good to change your diet, change the time and way you sleep, and doing things to control and sustain the good response. But still you can have recurrent episodes. Now we often see that people, once you have this and then when they have an endoscopy and they're told that, especially if they're told that they have something like hiatus hernia that we discussed a while ago, they tend to kind of focus on that, and then they think that there's something going on, and that focus on the or rather that worry will worsen all these symptoms, and they tend to feel this more. And then what happens is they would, now I mentioned at the beginning that a little bit of reflux is normal. They tend to make notice of that normal reflux, and they keep on worrying about that, and they end up getting repeated endoscopies. They go see many doctors, and they get repeated tests. They have multiple course of medicines. So you end up getting a lot of unnecessary things in you, just because we are worried about it. So that's something that we need to think of and understand and try to learn to live with the way that we kind of by changing the lifestyle. So that's the most important thing that I want to mention. So that comes after the assessment and reassurance. So we often see people coming with endoscopies, 5-6 endoscopies or 3-4 endoscopies done within the last couple of years, because they're excessively worried, and they go to a different person and they would again test the person. Another place they'll have another test, and so that's quite unnecessary, because it's something that is going to be a part of you, and sometimes it comes and it goes. But most often, if you change your lifestyle, lose a little bit of weight, stay active, and get rid of those lifestyle rather not very good lifestyle I would say habits, they would obviously feel better.
Just a question, you spoke of losing weight. Would you say therefore that if somebody is slim or slimmer, he or she may not have regular episodes of reflux?
Not necessarily. So but as I mentioned, when you suddenly gain weight, now when there is an issue with that valve, and you have a tendency to get reflux, and you suddenly gain weight, it can worsen. And when you have a tendency to reflux, when you lose weight, it gets better. But it does not necessarily mean people who are slim does not have reflux.
What can help, like heartburn? in the short term, say somebody experiences that, and even before seeking medical attention, would like to take something to get over that sort of feeling, which can be very uncomfortable within the system. What could you recommend?
Right. So that again is an excellent question, because a lot of people think eating helps and drinking milk helps. So now the bottom line is that when we eat, that includes drinking milk, what happens is that soreness or that irritation in the food pipe goes away, which is the same thing is done by drinking a glass of water. Whereas if you drink or if you take in food repeatedly, you get more acidity in the stomach, because acid is secreted into the stomach to digest your food. So when you eat, you have more acidity. So recurrent eating is not good for this, and most of the time if you drink a little bit of water, you get a temporary relief. If not, there are a lot of over-the-counter preparations, syrups. They are available widely, and you don't need a doctor's prescription to get them. You can get any of those things, and they would give a temporary relief. In the long run, if that does not help, it's again good to get some prescription medicine and get yourself assessed. So that's so all these over-the-counter medicines and the syrups are helping, will help, but not in the long run.
So, Dr. Time is catching up with us. What would be your take-home message?
Right. So, take-home message is that reflux is a normal phenomenon, but sometimes it can be associated with complications. It can be a feature or a bell of something that we don't want to get something sinister going on in the body. So if there is a recent change in these symptoms, or if you have heartburn or irritation of the throat or cough or respiratory symptoms, especially at night, it's good to meet your doctor, have a chat about it. But on the other hand, reflux or having reasons for reflux such as hiatus hernia are not very sinister sinister pathologies or sinister problems, and it's unnecessary for us to worry excessively about it, which it's in itself can make you feel that you have this problem or rather we amplify the problem. So and finally most of patients with excessive reflux benefit from simple lifestyle modifications and adopting a healthier diet.
Thank you, Doctor. And on that note, we end this interesting discussion on reflux. And we place on record our most grateful thanks to you, Dr. Isurujith Liyanage, consultant gastroenterologist and hepatologist of the University of Sri Jayawardhanapura. Thank you so much for being with us in the midst of your busy schedule and sparing your valuable time and expertise, your expert knowledge on this topic with our listeners. Thank you so much, Doctor.
Thank you. It's a pleasure to be here.
My thanks also go to Nishanta Manik-Divella for technical assistance. I'm Fatima Razik Khaida saying good night and hoping to catch you next Monday same time on Views on Health.